Welcome back. As we continue to move through Mental Health Awareness Month, it's important to highlight all the different areas of mental health, including in our community's youth. Joining me now from our sponsors at Horizon Health is Director of Child Adolescent Services, Melissa Walter. Hi, Melissa. Thanks for
Hi.
coming in.
Thanks for having me.
Of course. I want you to start off by telling us some of the trends you've been seeing lately in your work with children and adolescents.
We've just noticed larger numbers of children and adolescents presenting for services and greater need for treatment for depression and anxiety. Kids have become much more depressed and some suicidality as well.
And what are some of the most common diagnoses that you treat?
We treat depression, mood disorders, anxiety, and trauma-related disorders, some psychosis as well.
Now, are there any risk factors that parents and caregivers can look out for?
I would look for a change in your child. So generally, we're looking at kids having a change in maybe their sleep patterns or their appetite. Maybe they become more withdrawn or isolate a little more than they used to. With little kids, you might hear complaints of stomach aches or headaches, maybe problems concentrating or a drop in grades at school.
Now, since we've seen such an uptick in anxiety and depression, do you think that that is related at all to COVID and being in the pandemic and, that pause that the world had for a little bit?
Yeah, we've definitely seen greater numbers since then. I think socialization is a little more difficult for kids. They don't have the social skills maybe that they would have if they weren't at home for that period of time. Much more anxiety in large groups of people and coming into the classroom for sure.
My stepmother is a nurse, a psychiatric nurse in Connecticut, and she always says that it's heartbreaking because she also works with youth. When kids her age were growing up and they were going through tough times, they would say, "I can't wait to grow up so you could be on your own," right? Where do you think the shift came with kids not feeling like there's something to look forward to?
Yeah, I think there's a general lack of confidence in themselves, maybe in their ability to interact with the world. And I don't know, if we got those skills as kids when we were interacting with our peers and they just had that taken away for a period of time and it's just become more difficult.
Yeah. Can you talk a little bit about Horizon specifically and what services you provide to our community's youth?
Sure, we provide individual counseling, family therapy, group therapy, medication management services through our psychiatry department. And that's in the children's program. We also serve adults and have services for them as well, including inpatient treatment and rehabilitation.
Now, you also go into schools, is that correct?
Yes.
Can you talk about why it's so important to provide these services to young people directly through the school system?
Yeah, that's been so great because we're able to bring the services right to the child in the school. Parents have so many barriers getting their kids to services, whether it's they work or they have busy schedules. Kids have a lot of after school activities that they do, and so we're bringing the service right to them. Parents may also have transportation problems or just not know that their children need services, and so having that coordination with the schools and with the counseling center in the schools has been really helpful.
I imagine it's also a positive thing too if a source of stress or anxiety is in the home, being able to take that child out of the environment and be able to get help through the school district itself probably is helping a lot of other students that might not have been able to access that help.
Absolutely, and likewise, if the child is experiencing a lot of stress in school with their peers or academically, having the service right there is helpful for that as well.
And can you talk about the importance of asking for help? That's really the first step when it comes to treatment, right?
Yeah, and I think, so many children and teens especially are, at first opposed to counseling services. And I think I, would say to them, that's a place where you might experience some relief. It's someone to talk to that isn't going to share what you're saying to anyone else, and it's a safe space.
And I talk about this, with other people as well. And you touched on it. What are the biggest signs people can look out for, especially parents with their kids? Because there's a kind of a fine line between is a kid just having an off day or a couple of weeks and they're just going through a hard time and it's a phase, or something really wrong?
Yeah, I think you want to look at how it's impacting their functioning in all the roles that they're in. So are they able to participate with the family and family activities? Are they staying involved in their extracurricular activities? You know, are they performing at the same level academically, or are these things impacting those areas and causing problems for them?
When you start to see a real domino effect in their life, maybe that's when you know that something is wrong and we can get help.
Absolutely.
Okay. Thank you so much for
Yeah.
coming in, Melissa, and
Thank
sharing
you.
more about Horizon Health and all that you do. And viewers, if you are concerned about your child or teenager's mental health and are in need of resources, you can visit our sponsors at horizon-health.org. Thanks again for coming in, Melissa.
Thank you.